Good evening. My name is Ahmed Sharafuddin. I'm a medical doctor. And today I'd like to talk about one of the most common discussions nowadays between one of the medications, which called Ozempic or Mounjaro, which relate to one of medication family called glucagon-like peptide receptor agonist. And it's linked to thyroid cancer. So actually, this is not the first time to raise the discussion between the associations between the diabetes medications and cancers inside our bodies. It was raised before, something related to the cancer endometrium, cancer liver, and association to other oral anti-diabetic medications. But why nowadays they are concentrating on this family of medications, which called GLP receptor agonists? Actually, this discussion had been raised because of the intense need to this family managing the diabetes and diabetic patients, type 2, and also in losing weight. So GLP-1 receptor agonist is not only a medication to manage the diabetes as a monotherapy or as add-on, but also we can use it to lose the weight. So it will reduce the hazardous effect of obesity on our heart, our brain, our eyes, kidneys, and all of our internal organs. Many studies was published recently regarding the beneficial effect of the GLP-1 receptor agonist, and it showed significant importance of this family in reducing the risk of the cardiovascular event and cerebrospinal event also, especially more in cerebrospinal more than cardiovascular, but both showed effect. But today we will discuss this concern of many people, whether the usage of GLP-1 is associated with cancer, thyroid or not. Actually, it was discussed before in the old generation of this medication, whether it is associated with cancer, thyroid or not. And it showed only association between the usage of the first generation of this family and the cancer thyroid. But is it proven that this medication causing this problem? So many studies were done, and large cohort study was done recently in 2022. And actually it compared the effect of GLP-1 receptor agonist and other oral anti-diabetic medications. And it showed clearly that there is no observed risk of thyroid cancer associated with increased cumulative dose of GLP-1 receptor agonist use. So the thing that if you have family history of cancer thyroid, so basically you'd like to visit the gland doctor, so the endocrine doctor, and he will do the basic blood test regarding your thyroid, some antibodies, and maybe he will need to do imaging test of your thyroid. And after that, he will tell you that he will need some close monitoring of your thyroid. Because in some old studies, it showed that maybe if there is some suspicious nodules, and if some biopsy taken from the thyroid and showed some low-grade malignancy, so it is better to avoid. But in most recent studies, it showed that even if we started the GLP-1 with low dose or increasing cumulative dose with reaching to the maximum dose, it has no clear association with the cancer thyroid. So, in conclusion, if you have some family history or if you have some thyroid disorders, better to visit your endocrine, your gland doctor. He will do the necessary blood test, necessary imaging of your thyroid gland. Then we can decide clearly that we can start, if you can start the GLP-1 receptor agonist. So the answer is yes, you can start. If there is low risk, if there is no association between cancer, between your thyroid and your medication. And no problems to discuss all your concerns regarding this medication with your doctor when you want to start. That's it for today, and thank you so much.